Masturbation is one of the most difficult taboos to talk about. Should you do it or not? Is doing it more harmful, or is not doing it at all? How important is the technique used in this regard? Does masturbating cause infertility? Does hair grow on your hands and palms? Can married people masturbate? How does female masturbation differ from male masturbation? I provide medical and scientific answers to these and many similar questions. Be sure to watch the video to the end. I have very important advice for young people, couples, and parents. You will hear things you have never heard before for your health, and perhaps your life and destiny will change completely with this video. Masturbation, in its literal sense, is the act of stimulating oneself for sexual pleasure. This act may or may not result in ejaculation. The main purpose of masturbation is to reduce sexual tension and achieve pleasure. In almost all cultures, masturbation has been considered shameful or sinful for centuries. Even until the 1970s, medical authorities viewed masturbation as a wrongful behavior. Today, however, masturbation is accepted as a normal sexual behavior from a medical and psychological perspective. However, there are very important rules, exceptions, and details regarding this topic that we need to discuss. In the classic sense, masturbation begins as an impulsive act during adolescence. Subsequently, although it varies depending on circumstances, its frequency decreases over time, especially after the individual begins an active sex life. In fact, it should decrease. If it does not decrease, but instead increases, there may be a psychological problem. At this point, rather than whether adults masturbate, what masturbation means to that person, how and under what conditions it is done, is a much more important issue to be examined from the perspective of sexual medicine. First, let me emphasize these 2 points in particular. If we understand these 2 concepts, we can also change our perspective on masturbation. First, masturbation is a narcissistic act, friends. In other words, the individual who masturbates is saying, symbolically speaking, I can be self-sufficient. I don't need another person for pleasure or enjoyment. So, in fact, masturbation means a certain degree of psychological regression for adults. Indeed, individuals tend to masturbate more and more often, especially when under relational stress. Masturbation is like a safe harbor for them. So, masturbation is never just masturbation. It has a deeper meaning. Narcissism, or being narcissistic, meaning that a person appreciates themselves and is self-confident, is a good thing to a certain extent. It brings success to the person both in their professional and private life. However, not liking anyone but themselves, seeing everyone as a tool to help them, being devastated by the slightest criticism, constantly expecting appreciation from others, and having a crisis when they don't get it are general personality traits of narcissists. Therefore, people with excessive narcissistic personality patterns often have problematic relational dynamics. As with everything else, excessive narcissism damages a person's social relationships, and this personality trait ultimately harms that person. We know that individuals with excessive narcissistic personality traits often struggle to remain monogamous or prefer masturbation over partnered sex. Similarly, masturbation, when done in moderation, is a good thing in terms of getting to know and loving one's own body and self-esteem, but excess can mean abusing and even mistreating the body. People who masturbate excessively generally experience a state of unhappiness. The very thing they love so much and cannot stop doing has turned into an act they hate. Second point, masturbation is a masculine act. Note that I didn't say it's unique to men, I said it's a masculine act. Women also masturbate, though not as frequently as men. We all have masculine and feminine sides, and masturbation is essentially a masculine behavior, trying to get to the result as quickly as possible without putting in too much. Effort is a behavior typical of men. The goal in masturbation is to reach the highest quality and cheapest orgasm as quickly as possible. In fact, women also perform this act with their masculine side when masturbating. The clitoris, the organ they use for masturbation, is actually the biological and embryological equivalent of a smaller penis. The real female organ is the vagina, not the clitoris, friends. While masculine energy is satisfied with the final result, feminine energy is in love with the process and derives pleasure from it. For this reason, she does not care much about the number of times, the score, or whether she ejaculates. At least, it is not her priority. Contact, emotional, transfer, living in the moment, becoming one with her partner, feeling, desired are the feminine aspects of sexuality. The absence of these makes women unhappy in the short term and men in the medium to long term. For this reason, a sexual life based solely on masturbation is not very sustainable, especially for women, because it's not just about ejaculation. If it were, all women would live happily ever after with their sex toys, but that's not the case, is it? That's why a man can somehow get by with masturbation, but a woman inevitably needs another person, a subject. Masturbation or sex toys alone are not enough for women. They feel meaningless and tasteless, leaving behind a feeling of incompleteness. For men, the pleasure obtained in the end is complete and whole. For this reason, it carries a great risk of turning into a habit or even an addiction. So, should men or women masturbate, or should they not do it at all? If they do, how often should they do it? Friends, we must use and protect our bodies and limbs so that their functions do not deteriorate. If a man does not have the opportunity for sexual intercourse, he should masturbate at regular intervals. Frequency is a relative concept here, and there is no exact formula. But our rule is this: it should be to an extent that does not negatively affect the person's social life and relationship dynamics. In other words, if you stay at home and masturbate instead of going out and socializing, or if you prefer, masturbation over other social activities or relationships with a partner, then there is a problem. In summary, masturbating a few times a week in a proper manner will not harm anyone. Not doing it at all, or doing it very rarely, however, can invite many sexual dysfunction, problems in the future. Achieving sexual harmony with a partner or spouse can become more difficult as you age. For this reason, I say this to young people: if you don't see yourself having the opportunity to be in a relationship for spiritual or material reasons, don't delay the marriage process too much, friends. Unfortunately, nowadays, with education, school, and then establishing a career, marriages are being postponed to much older ages. This situation can also lead to an increase in sexual problems. Remember, sexuality is a skill learned in youth but developed over time. It is important not to miss the spirit of the times. Let's get to the technical aspect. The technique of masturbation is extremely important, friends. Again, it's very difficult to give a specific formula here, but never forget this. I'm saying this from a male perspective. The closer you can mimic the union of the penis and vagina, the more correct you are doing it. This will make your transition to sexual intercourse that much easier. To do this, you must first choose a comfortable environment and set aside some time for yourself. Never masturbate in stressful, rushed environments or under the fear or pressure of being caught. Second, when masturbating, don't just focus on the penis and a single point on the penis. Imagine your sexual areas as a whole. Third, be sure to use a lubricating gel or cream, because the vagina is not a dry organ. The more your organ gets used to a wet, slippery surface, the more it will learn to feel the vagina. Otherwise, a penis that gets used to dryness may not want the vagina in the future. Friends, fourth, don't apply too much pressure to your penis. Especially harsh and traumatic techniques applied to a single area can desensitize the penis and lead to erection loss and inability to ejaculate during vaginal intercourse. In summary, masturbation should be done at a time when you feel good and comfortable, with gentle movements, using lubricant, and with soft stroking movements as if moving inside the vagina. It is very important to follow these rules for your future sexual adaptation. Now, let me list these important rules again in 10 points so that you do not experience sexual dysfunction in the future. 1. Do not masturbate hurriedly. 2. Do not masturbate if you fear being caught or exposed. 3. Make sure your genital areas are exposed and do not masturbate through clothing. 4. Don't immediately focus on the penis or clitoris. First listen to your body and focus on pleasure. Know that you are making love to your own body and enjoy it. 5. Respect your genitals. Do not use excessively harsh techniques that may harm them. Avoid using objects or sex toys other than your hands and fingers. Avoid masturbating dry or by rubbing against a surface. Avoid masturbating with excessively fast movements. 9. Avoid constantly stimulating your genitals in the same spot. Never feel guilty afterward. Always remember that this is a natural part of your masculine and feminine nature. It is also worth mentioning female masturbation. Unlike male masturbation, female masturbation has some positive aspects. First, after ejaculating during intercourse or masturbation, men enter a recovery period and cannot achieve an erection for a while. We call this the refractory period. This period begins to lengthen with age and, although the interval varies for each man, this rest period can sometimes last for hours. Therefore, a man who masturbates does not desire sex for a while. This is natural. However, this does not happen to women. If a woman's feminine energy and passion are intact, masturbation does not easily reduce her sexual desire. In fact, masturbation often increases a woman's need and expectation for her partner and can also cause an increase in sexual desire towards her partner. Secondly, men cannot masturbate simultaneously during sexual intercourse. Women, on the other hand, can include simultaneous masturbation with clitoral stimulation during intercourse and discover ways to enjoy more pleasure. We call this the bridge technique, and particularly recommend it for women experiencing orgasm issues. In summary, whether married or not, we can more readily recommend masturbation for women than for men. So, should married couples masturbate together? I definitely think so. Mutual masturbation is also called partner masturbation. There's a benefit to this, folks, so don't ask what the point is. As we know, every organ or system can malfunction one day, and everyone can experience sexual problems at some point in the future. When couples know they can make each other happy without sexual intercourse, they don't experience the stress of it. Therefore, sexual problems are much less common, even if they do occur, because there is always a plan B. There is no emotional disconnect between them until the problem is solved. In other words, because confining sexual happiness solely to penis-vagina intercourse is contrary to the spirit and philosophy of the act. Free couples tend to have longer and higher quality sexual lives. Don't say, "We'll think about it when it happens to us." Start now so you can experience and test what I mean. Unfortunately, it's not really possible to apply this when it happens to us. On the other hand, we don't think it's right for a married man to masturbate alone secretly from his wife without any particular reason, because it will reduce his sexual desire. However, the reasons why that person has turned to masturbation need to be examined separately. The reason may lie in relational dynamics. Therefore, for us, the meaning of masturbation is much more important than prohibiting it. If we can understand the meaning, the man can reduce his masturbation behavior or even stop it altogether. Let's address some common sexual myths circulating among the public. Masturbation does not cause infertility, prevent growth, cause acne, weaken a person, make them thin, or cause hair to grow on the hands or palms. In women, the hymen is not damaged by clitoral stimulation alone, unless there is vaginal penetration. These are superstitions, but such statements frighten young people and adolescents considerably. When an adult tells an adolescent these things as if they were true, it creates heavy psychological pressure on that adolescent. Adolescents who continue to masturbate with feelings of guilt and sinfulness may later develop major sexual dysfunction. Parents should never, ever have these conversations. If you have a child in their adolescence, you must respect their privacy. Of course, you are not your son or daughter's friend, nor should you be. Ideally, consult a trusted expert on this subject and have them see your child. Ensure that your child is informed and aware of sexual health and masturbation issues. Never enter your adolescent child's room or bathroom without permission, and never forget that they are an individual. Do not forbid masturbation, do not embarrass them, and never resort to punitive methods. Believe me, discovering sexuality in other ways, or not discovering it at all, will have much more destructive consequences. If you want your children to have a healthy family life in the future, you should avoid these behaviors. Yes, friends, what I have explained so far within the ethical rules are general medical concepts, but of course you may say, "I don't think so," or "I don't feel that way," because humans are not a simple form of life that can be explained by a single formula. Human biology, psychology, relationships, and the environment in which they live are a whole. If I have been of some help, I am happy. Please don't forget to like this video and share it with your loved ones. I look forward to your contributions in the comments. Stay healthy.